Before we begin, I just wanted to mention that if you have any questions, please feel free to use the chat to type your questions in. I won't be able to access the chat as I'm presenting, but at the very end, I will go through the chat and try to answer as many questions as possible. And you can send as many questions as you need as we go along. All right, so let's get started today. Okay, so the medical admissions that we've been doing with Potomac Oak Tutoring has really focused a lot on all the different types of services that a student from the high school level to the undergraduate level to the post-baccalaureate level to even postmasters to all the students' needs, basically. And so what I like to do is I always try to give advisory services. And that's usually the first sort of line of I might be interested in medical school, I might be interested in healthcare professions, but I'm not quite sure if this is the path for me. But if it is the path for me, I want to be prepared, right? So that's typically what our advisory services are about. In terms of actual admissions and the application process itself, we provide services involving essay editing, which is the majority of the application, as well as interview prep, which is very important, obviously, in terms of admissions to medical school, because being a doctor means you need to be able to talk to people. So having that sort of prep is really, really important during the medical school admissions process. Application coaching, making sure that all the activities and GPA, as well as any sort of recommendation letters, are all kind of fitting in well with the narrative and story that we're really trying to provide, right? And then lastly, we also provide MCAT preparation. So for those who are unfamiliar, MCAT is the medical college admissions test. Think of it as the SAT or ACT for medical school. It has 5 different subjects that all cover topics ranging from physics, chemistry, biochemistry, biology, critical reading and analysis, as well as psychology and sociology. And so the idea here is we try to provide as many services as we can to really prep the student using more of a holistic approach based off of their needs. So this is my background. I went to University of Pennsylvania for undergrad. I was a biology major and I was really interested in psychology. I then spent a few years at the NIH because I really love research and biomedical research, which I ended up at Penn State College of Medicine doing an MD PhD. And right now I'm currently in my PhD program. If anybody who's interested in science, I do immunology research related to heart failure and cardiovascular disease. And so I have a passion for working with students. I've been tutoring since I was in high school, which was a really, really long time ago. And I really just like to see people thrive and reach their full potential. And so that's kind of my approach in terms of when I work with students to have them understand what it's like to become in my shoes one day and beyond, obviously, but also how to get there, even when there are setbacks or roadblocks. And so today, my objective is really to talk about uh, different pathways to medical school, because I'm sure some of you who are interested in medical school, and I know I'm talking to a lot of parents today and maybe some students as well. Uh, medical school might be very familiar to some of you, but in America specifically, medical school is the path to medical school is not very universal, meaning it's a little bit different than outside of this country. And so the idea here is that we want to make sure that if a student doesn't have a sibling or a parent who has gone through the medical school process in the United States, that they're not completely lost. And so for me personally, both my parents are in finance, so they have no idea what the timeline or what the process was like. And I had nobody in my family who was a doctor. And so for me, I really had to figure it out and kind of bootstrap my way through the medical admissions process. So I don't want people to make the same mistakes that I made, which is why, again, I'm so passionate about consulting and making sure that students are on the right path if they do want to become doctors. And so my idea today was to really give an overall view of the different ways to get to medical school. And so we'll talk a little bit at the high school level, the BA MD programs, and those could also be BS MD programs. And then we'll talk about the traditional path. This is the 4-year bachelor's degree and then medical school afterwards, right? And then we have the DO programs, which are osteopathic programs. So we'll talk about that and what the difference is between DO and MD. And then we'll talk about different paths, alternative paths to medical school as well. And we'll go into detail. And again, please, I'm happy to repeat anything. Just, write your questions down if it's a clarification question or anything like that. And I'll be happy to go through it at the end. Okay, so you want to become a doctor, right? So I'm sure a lot of you who are here today are really interested in helping people and working with patients and wearing the white coat and the stethoscope. And the question becomes, how do I do this, right? So if any of you uses AI, you can ask ChatGPT, how do I get to medical school? How do I become a doctor? And, it'll tell you, and it'll tell you very simply, right? Go to college, you have to get a bachelor's degree in something. And then, you go to medical school, and that's 4 years. So 4 years college, 4 years of medical school. And then after you finish medical school, you can start your residency and the chosen specialty of interest. And then depending on your residency, it could be from 3 years if it's internal medicine to 7 years if you're interested in cardiothoracic surgery, for instance, or neurosurgery. And then you can become a doctor officially, and you can work and practice for the rest of your life, saving lives and helping others in your community and beyond. However, this path is what most people think is the right path to medical school. And for, I would say, maybe 50% of applicants, this is how they get to medical school. But you will find that in medical school, there are students from all walks of life. So in my medical school class alone, I had a 40-year-old actually in my medical school class who was a high school teacher, for instance. I had people who took time off, and by time off, they took gap years. They took 3, 4, 5 years to do different things. Somebody in my class was in the military and decided to do medical school after doing the military. Others, I had a student who she was a chef, and then she decided that she, was done with the kitchen and she wanted to go to medical school. And so you'll hear these stories all the time. So traditionally, yes, you can start medical school at around 22 years old, 23 years old, but your class is going to change. And there is going to be so much diversity within your class. People who might have children, people who are a little bit older, people in their 20s, or late 20s, even early 30s, who could all be in your medical school class. And that same diversity will translate into residency. And so the question is, do you want this straight path? And I think most people will say, yes, Farah, we want the straight path. We don't want to take tons of time off to try and do other things. But for other students, you might have multiple interests and talents, and you might want to take some time after medical school, or sorry, after college, right? And explore your interests. And so those are one types of students, right? Like the students who actually want to maybe travel the world or do something, take a break after college. And then you have the students who unfortunately might have life happen to them, right? So some major setback, maybe during college, they were sick and they had to drop a class and now they have to take a gap year. Or maybe during college, something unfortunate happened that affected their family. And so now they didn't do well for a semester and their GPA is really low, and getting into medical school just became 10 times harder. or they just found the MCAT to be very, very challenging for some, for many reasons, because it is a challenging exam. And so all of these different roadblocks and challenges to me are just setbacks, right? And so becoming a doctor, it is inevitable that students will face challenges and setbacks. And the idea is how do we recover from these setbacks and how do we overcome these challenges to make sure that we can pivot in a way that will still allow us to be successful in the admission cycle, right? And so I call this the winding path. And and the straight path is great. I took a little bit more of a winding path myself because I was always interested in research and my debate was always medical school or a PhD. And so I think some students might resonate with that. And so if you're already somebody who might be talented in multiple things and you're already thinking, maybe being a doctor is something I'm considering, but I'm also considering other things, then the winding path could end up becoming your road. But the idea is that there is always a road to becoming a doctor. And I have personally witnessed this with my own students as well as myself. Okay, so I talked a little bit about this briefly, mentioning it here again. So typically, in order to become a physician in the United States, a practicing licensed physician, you have to have a bachelor's degree. Now, this typically takes 4 years. For some students, they can fulfill their bachelor's degree requirements in 3 years. I haven't met anyone who has done it in 2 years. But most of the time, 3 to 4 years, and you can basically major in anything, okay? You can major in sociology and fulfill the pre-med requirements. And the pre-med requirements are basically a full year of chemistry, a full year of biology, a full year of physics, so that's 2 semesters in college, and then a full year of organic chemistry, so that's organic chemistry 1, organic chemistry 2, and then you have to take an English class, at least 2 semesters, as well as 2 semesters, 1 to 2 semesters of a math course. So students typically take calculus or statistics. And some medical schools have different requirements as well. They might want you to take biochemistry, or they might want you to take sociology. And so the good news is most bachelor degree programs actually do have these requirements already within their general education requirements. The nice thing about being pre-med is, again, if you are interested in, say, economics, you can major in economics, but then take your pre-med requirements. And so you can finish, right, your pre-med requirements, graduate with an economics degree, and then you can work on Wall Street for a year or two and then apply to medical school. And I actually know people personally who have done that when I went to Penn. And so again, it is flexible. The idea is that medical schools want students who are diverse. And by diversity, they're really talking about doctors who will be able to connect with patients from all walks of life. They don't necessarily want all their medical school graduates to be biology majors who've done research, like myself, which tends to be the majority of students because you have to like biology, right, in order for you to, or at least tolerate biology in order for you to become interested in medicine. But you don't necessarily need to major in it, for instance. So plenty of ways to get into medical schools with other majors. So that's one of the misconceptions that I wanted to just mention immediately. So after you finish your bachelor's degree, you finish your pre-med requirements, you take the MCAT, you do well on the MCAT, hopefully, then you can apply to medical school and then get your medical degree, and that's 4 years it takes. And that's non-negotiable unless you do some sort of program where they combine medical school with residency. And there are some medical schools, like Penn State does that, where you can apply into a medical school with the residency of interest. So then you don't necessarily need to do the full 4 years of medical school, but that's a different story, and that's not very common necessarily. So most students have to finish 4 years of medical school and then do residency. And again, that ranges from 3 to 7 years. And then after residency, you can decide to further specialize and do something called a fellowship. So a fellowship is typically after residency, it's 1 to 2 years. You see this in different specialties like anesthesia and surgery and pediatrics. And this is if you want to be a specialist in something and maybe you really want to work with a certain disease or a certain type of disorder, for instance. And so the fellowship will allow you to do that. Okay. Okay. So this is mostly for my high school students who are watching this right now, who want to become a doctor one day, hopefully, or parents who know that their children might be interested right now, and they're maybe freshmen or sophomores in high school, or juniors or seniors. And really, it's nicer to know you want to become a physician the sooner that better rather than later, right? That's the idea. Why? Because you can prepare. It is very competitive to get into medical school. A lot of people want to become doctors because of so many reasons, right? And so the career itself attracts very bright and very motivated students. And so if you're a high school student right now, the best thing you can do is start getting exposure, okay? Start volunteering at the hospital, start shadowing, getting to know what it means to be a doctor, okay? You don't necessarily need to be in the OR to do this. You can work with a nurse, you can work with a physician assistant, you can apply to be a medical assistant, you can even just volunteer and be around the environment just to see what it's like. What's nice about the high school experiences from a medical admissions perspective is that if you start in high school, this allows you to possibly continue those hours while you're in college. So you can come back during winter break when you're a freshman in college, for instance, and you can continue to do your hospital volunteering. And all those hours will count from high school all the way throughout college. So if you go in with a ton of experience already, all of that will count towards your medical school application. Now, that's not what's going to get you into medical school, but it is going to show medical schools how committed you are. Okay. It could be an advantage, but that's not the main thing they're looking for. I personally think if you are somewhat interested in medical school and somewhat interested in becoming a doctor, trying to do this as soon as possible can really help you so that when you're in college, you can start to pick different activities. You can start to shadow different specialties and start to really pinpoint your interests and narrow them down. Another important thing I would say for high school students would be starting to build the discipline and the mental toughness. So again, it's a long road, as you all just saw. The timeline is long, and there needs to be a certain level of discipline. Okay, and I advocate this to all my students. There needs to be, I'm going to wake up at this time every day, and I'm going to go to the gym, or I'm going to make my bed, or I'm going to do these simple things that are going to allow me to have some sort of self-control so that when I'm in college and I don't have mom and dad telling me to do things, I can do it on my own, right? Because in college, you're going to be doing your laundry, you're going to be in charge of navigating your own schedule. And so there needs to be a certain level of discipline, especially in the age of social media, where we get so much dopamine so quickly, right? Where this career requires patience, requires resilience, requires moving through challenges and setbacks in a very disciplined way. Okay. And lastly, I would say is, and this is always hard, I know, because it depends on the high school you go to and it depends on the teacher, but I would say take your science courses seriously. Okay. It's a huge difference when you see a student in high school who took AP chemistry or took AP biology and basically cruised through it, and then they enter college and they're really struggling. Like they have no idea what they're doing, and then they don't do well in their classes. Okay. And that becomes a major setback from a medical admissions standpoint, because if you get a C in a science class, that really affects the GPA. Because for medical schools, they look at science GPA as well as overall GPA. And so my best advice for high school students is don't cruise through these classes. Just because you can get an A in AP biology from doing the work doesn't necessarily mean you're prepared for college, right? So try to take the exam. Try to get a 5 or a 4 on the exam. And if you don't, it's not a big deal. It's not the worst case, but at least try to put in the effort with the material as early as you can, because the material only gets more complicated, right? So the more comfortable you get in high school, the more comfortable you're going to be in college. And this is just how it is. And it's not something you can avoid. Um, so that's my advice for high school students. Now, at the high school level, you can apply to BA and MD programs or BS and MD programs. These tend to be highly competitive. So if you're somebody who's in high school, who's doing well in AP classes, who has done all these different activities, is doing the hospital shadowing or the physician shadowing, is doing the hospital volunteering, maybe has worked with the community, maybe you've worked with, I don't know, refugee populations, for instance, or maybe you started a food bank or like an event with a food bank or something like that. And you've kind of shown this commitment that you're interested in medicine. You can handle the academic part of it. You have strong letters, right? Now you might be competitive to apply to these combined programs. And what's nice about these combined programs is, and I put this in bold and I underlined it, where I said pros is no MCAT, right? But not all of them are no MCAT. So I will clarify that. But some of them don't require a medical school admissions exam, which is great, right? Because it's guaranteed admission. A lot of them do require that you keep a certain GPA. Some of them do require you take the MCAT, but their threshold for the MCAT is much lower than if you were to apply with not being in this program. And so the idea is they basically take you from high school and they make you take the pre-med courses, and they kind of tailor your undergraduate experience so that you finish in 3 years for your bachelor's degree. You take the courses that are going to be the most relevant for medical school, like physiology and anatomy, and then you go to medical school within that same institution. So one of the most competitive ones that maybe some of you have heard of is Brown University's combined BA MD program. That one is an 8-year program. Penn State has a 6-year program, which I know a couple people who were in my class who were part of it. And it's very attractive, right? Because it shaves off years of your career, right? So you're not spending more time doing a bachelor's degree or more time in medical school. However, there are some cons. And I would say the biggest con would be if the student's not sure 100% of medicine, and now you've committed to this program, and now you've committed to medical school. And another thing too is whether or not the student is emotionally mature. And so, it will definitely be a major ego boost, I would say, if a student who from high school knows they're in a medical school, right? And maybe because they feel that they are already they don't have to work as hard. And so I've seen that with students where they'll start to slack off a little bit. And then now their GPA isn't as good. And now they do have to take the MCAT. And so there is a con to it, because if the student isn't 100% sure about medicine, or at least like 80 to 90%, right? And isn't emotionally mature 100%, then this might not be the best program, right? Maybe it's better to go to the traditional route, okay? And so the traditional route is really, let's do a bachelor's degree or a Bachelor of Science, so you can become an engineer, for instance, or you can do like a business major, for instance, or you can do a biology or biochemistry or very science-heavy physics major. And basically major in any topic you're interested in, and then take the pre-med requirements and take the MCAT and just do it the traditional way, okay? Again, majority of students do it this way. The pros about this, again, is the flexibility, okay? So you can take your time. You have 4 years. You can arrange your schedule in a strategic way, okay? And that's usually what I really help my students with, is how do we maximize our schedule so that we're not overdoing it in one semester and we're taking too many science classes, or we're not doing enough, right? Or how do we arrange it in a way where we can study for the MCAT while we're taking classes, or arrange our summers so that we can take maybe an elective and spend the whole time getting an EMT certification so we get some clinical hours in. So that's really what getting the bachelor's degree first is all about. It's all about maximizing our options while also creating multiple paths, right? Because everybody who applies to medical school always has to think of a plan B. And I'm sure all the parents here can agree that life happens and sometimes, you really want to do something, but then there is a setback, right? So having a plan B becomes really important because, again, it's not guaranteed you'll get into medical school. It is very, very competitive. And at some point, there is a certain amount of time that students can take. So again, bachelor's degree takes 4 years, but you can take as many gap years, which are years before medical school, in between your bachelor's degree and medical school, until you get in. I know somebody who was at Penn. It took him 7 years, which is like really, really a long time, right? Because he just didn't have a good GPA. And it becomes really hard when you don't have a good GPA to bring that GPA up. And so the MCAT expired, so he had to keep taking the MCAT, but eventually got into Tufts University, which is amazing. And now he's finishing up his residency. So, there's so many stories of people who have just shown resilience. And this process is one of those big challenges that students will face, is getting into medical school. But once you're in, it's a great experience. If patient care, being a clinician is really what your dream is. Okay. So I think this is really the meat of what I wanted to discuss because I had so many questions from last year's seminar about different programs and different ways to get into medical school. And so this is my opinion. And again, my opinion is based off of my personal experiences and experiences that I know of people who've gone through it. And essentially, the MD versus the DO. So traditionally, when I was in college, which was a long time ago, it was always known that if you didn't do well on the MCAT, then the students will go and do something called a DO. Okay, so DO means it's a doctor of osteopathic medicine. MD is considered an allopathic. Okay, and an allopathic school, so these kind of stemmed from the 1800s. So this was when early American medicine was trying to figure out how are we going to cure disease. And the allopathic school of thought was always about let's try and find treatments. Let's try and find drug treatments. And let's use these drug treatments to make people feel better. That was the allopathic school of thought. The osteopathic school of thought was always drugs are important. However, maybe we should also focus on muscle manipulation. Maybe the pain that this person is feeling, maybe instead of giving them heroin or opiates at the time in the 1800s, they're like, maybe we can try and, I don't know, manipulate their muscles in a way that could alleviate their pain. Okay. And so both of these schools of thought basically today became, they turned into these modern schools of MD versus DO. And so the DO programs are less competitive. So that is the one thing about osteopathic programs in general is that they are less competitive. And traditionally, like I said, students who didn't score well on their MCAT, they would apply to osteopathic programs if they didn't want to have to spend another year studying for the MCAT, or take more gap years to take more classes if their GPA was low. So the advantage of the osteopathic program at the time was it gave students who really wouldn't have had the opportunity to be in medical school and to become a practicing licensed physician in the United States. So next time you go to your doctor, just you can always look at the two letters after their name, and there's MD or DO, and you can have your family medicine doctor is a DO or MD. Anyway, the point is that the DO programs in general used to be focused more on primary care medicine. That means that if you need to take your child to the pediatrician, right? That's a primary care doctor. If you needed to go get yourself a physical for the year, that's your family medicine doctor, or a general practitioner. And so there's a strong focus for osteopathic programs to provide residencies for students who are interested in primary care. So there's family medicine, there's pediatrics, and then there's also internal medicine. So internal medicine is basically general medicine, and takes about 3 years to do that residency. And after internal medicine, you can apply to other residencies like cardiology, for instance, or allergy and immunology, or rheumatology. And so there are other subspecialties within the internal medicine residency that you can do. So again, traditionally, primary care focus, but if you were a DO and you really wanted to become a cardiologist, you can, right? You can do an internal medicine residency, and then you can apply for cardiology. But for osteopathic programs, and I say the but with emphasis here, because there are more competitive specialties out there. So right now, one of the most competitive specialties is interventional radiology, as well as anesthesia and dermatology. Those are the top three right now that are very, very difficult. So traditionally, it used to be neurosurgery, and it is still very competitive. And cardiothoracic surgery, all the surgery residencies are still very competitive. But there's this push now where students want more of a lifestyle, right? And so specialties like dermatology and anesthesia provide more of a work-life balance than, say, surgery, where you have to work 80 to 100 hours a week during residency. And so, again, back then, osteopathic programs might have had a stigma, but today they don't have that same stigma. Now, is there still a lingering stigma? Yes, but it's so difficult to get into medical school these days that having a score from 10 years ago would have gotten you into an MD program, but that same score is not good enough anymore. So since there's such this huge competitiveness to get into medical schools, the DO programs have now become more competitive. And they've also, their students have gotten more academically finessed in a certain way because of the competitiveness. And so now there are osteopathic programs where you'll see students match into dermatology, or there will actually be partnerships between the osteopathic school with a residency, with a hospital, like a private hospital, for instance, that got accredited and only wants osteopathic students. So there is a strategy involved with doing a DO if you don't have the best credentials. Okay, so if you just struggled with chemistry, for instance, and your GPA is like a 3.2 or 3.3, you won't get into an MD program unless you have stellar stats for everything else. But with a 3.3 and a decent MCAT score, you might have a shot at a DO program. And don't take my words for it, but these are kind of the numbers that you have to start to think about when you're applying to medical school. Now, MD programs, on the other hand, they are, again, allopathic. They focus mostly on really understanding drug treatment and how that works in terms of patient care. Same way osteopathic medicine does as well. They also study the same sort of material, except osteopathic programs, again, they're going to focus more on this musculoskeletal connection. But with allopathic programs, there is a broader residency choice. And so what's nice about MD programs is that if you do well on your STEP exams, okay, which are the board licensing exams, then you can basically, the world's your oyster, right? Because you are getting an MD from a school in the United States, you did well on your board exams, assuming you did well on your clerkships, which are the last 2 years of medical school where you're doing your clinical rotations, you can basically decide if you want to do a very competitive specialty. You can. It opens that door, and it's easier to get through than, say, doing it through the DO pathway. Now, again, it's not impossible to do it through the DO pathway. If you want to be an orthopedic surgeon, you definitely will have more of a chance in an MD program than in a DO program. But again, it's not impossible because there are orthopedic residencies that are attached to DO programs. Okay. Lastly, one of the major differences that I will talk about between MD and DO is this emphasis on research. So for me, I love research. I can be in a lab all day. But other people, they hate it. They're just like, what am I doing? I'm wasting my time. I can't keep pipetting. I can't keep, dealing with cells and failed experiments, right? And so allopathic programs really focus on having students participate in research. And so the type of research I just described is biomedical research, but there are other types of research, right? There's epidemiological research, right? So a lot of the research that came out during COVID was actually spearheaded by medical students, surprisingly, where we would get patients, right, who had COVID, and it's like, okay, let's analyze their blood. That's easy, right? Get an IRB approval and let's start looking at how COVID might affect certain cell types. And so the idea is that because there is this emphasis on on research, students will have more exposure to research at an MD program, and they might actually like it and pursue more academic pathways. And so if you're thinking you want to go to a top residency program, almost every residency program, requires some sort of research for the residents, especially if it's, again, these more competitive specialties. And so having that strong research background, publishing clinical studies, even case reports, for instance, can really help you get into better residency programs. And so that's really the major difference, I would say, between MD and DO. If you're somebody, again, who wants to be a pediatrician, has always wanted to be a pediatrician, you can do a DO and you can become a pediatrician. You don't have to, you know, have the highest MCAT score, take 2 gap years to do, I don't know, Teach for America or Peace Corps. You don't have to do all of that. You can do what you can as long as you can get enough experience and show that you're interested in pediatrics and primary care. Okay, so I always wanted to mention this because this is a hot topic in in discussions about medical schools. So the third option, okay, so we talked about BA programs and these joint programs, BA and MD programs. We talked about doing it the traditional way, getting a bachelor's degree and then applying to medical school. So we have our MD versus DO discussion that we just had. And then the last discussion is, okay, Farah, I did not do well in the MCAT. I took it 3 times and I just can't break a 500. So on the MCAT, really you want to get between like a 510 and a 515 if you want to be very competitive for MD programs. And if you're thinking DO, I would say between a 504 and a 507 is acceptable for DOs. And anything above a 507, you might be at a good situation for an MD program, depending on your GPA, where you went to school, and all the other factors that are involved in medical admissions, which I'll talk about. But if you're somebody who just really bombed undergrad, like 2 point something GPA, or maybe had a good GPA, but then just had really bad test anxiety and just couldn't do well on the MCAT, then this is the last resort option, is what I'd say. So this is going to an international school, okay? So specifically for US citizens, okay, and you don't have to be a US citizen, but if you're a US citizen and you went to high school here and you went to undergrad and you're kind of in this boat, this is usually the option that most students will take if they cannot get into an MD or a DO program. They will apply for Caribbean schools. And there's a lot of horror stories about Caribbean schools if you go on Reddit or any online forum. And The issue with Caribbean schools is that they tend to take everyone, okay? Um, and if they don't take everyone, it's because there could be a really big red flag and there might be some sort of probationary period that they make you take. And it depends on the Caribbean school. So there are good Caribbean schools, like St. George's, for instance, is a good Caribbean school that has excellent match lists. They match their students, and their students tend to be successful if they're able to continue and pass all the classes and finish. The issue with Caribbean schools is that there are lots of Caribbean schools where they don't have a great match list and they could be predatory, meaning if you fail a class, they make you retake that whole semester and you have to pay the entire tuition again. And so I know people that I went to high school with who did do this, and it was predatory for them, but they did finish and they were successful and they did get residencies. And I know people who tried and went to the Caribbean and were unsuccessful and were put in debt. So, and you'll hear all these stories about Caribbean schools. So, my take about Caribbean schools is that this is really like last resort. There's something, a huge red flag on your application. Maybe you were caught cheating. Okay. So you got honor coded, you applied to medical school, and even with all your good grades and everything, nobody took you. Okay. This could be an option for you. Again, if you didn't do well on the MCAT or you already took 3 years and you just want to start, okay, this could be an option, but it's not, again, it's not the best option and it's not the first thing I would do. I would apply to programs first, see where you are at, try to fix your applications, be strategic. And then if you're still holding on to this dream and there's no other career for you, then do it. But be aware of the predatory nature, be aware of the financial risk that you're taking, and understand that it could be a good opportunity if you are successful. And that's the key, if you are successful. Because again, not every single Caribbean medical school is the same. Okay. So it's high risk to do it, but I know people who've done it who have been successful, and I know I have an attending professor at Penn State who she did it, and she's a professor, and she's in department. So there are people who come out of this successful. So it's not like this is not a good option at all. It could be a good opportunity, but you again have to be disciplined and you have to be prepared and you have to understand the risks that are involved with doing it. So I'm happy to answer more questions about Caribbean medical schools if they come up. But again, this is a very controversial topic within the medical community because of all the stories that you hear, the good and the bad. Okay, so as a summary, these are some of the things that I think are really important. And I've already mentioned some of these. But essentially, the point is to start early, okay? The earlier you start with the planning and the advising, the earlier you will have the opportunity to cater your application in a way that's going to make you competitive because it is important to market yourself in a competitive way. You're dealing with some of the most motivated students who are competing against you. And so it is a little bit of a competition in a way where be you do need to show the best version of yourself to medical schools. And that kind of goes hand in hand with building a narrative. So that's really what I work on with my students is making sure that if you're going to be spending, I don't know, 10 hours a week doing this activity, that it's an activity that's going to make sense with the things that you've previously done, right? Or is building upon the things that you've done. Another important focus that I give to my students is make sure you're getting clinical experiences because the idea of becoming a physician is such a grand idea and it is an identity, right? You're kind of like, I'm a doctor, and people start, calling you doctor even before you're in medical school. And so you have to make sure you like people. You have to make sure you can work with others, right? because it is a team sport in a way. You're working with nurses, you're working with PAs, you're working with NPs, you're working with hospital staff, right? So you need to be able to work well with others, right? And you also need to be okay with certain clinical experiences that might make you a little bit uncomfortable, right? Seeing somebody suffering is not a very happy experience. It can take an emotional toll. And so the sooner you get that exposure and the sooner you can process your emotions and make a decision like, okay, I can live with seeing somebody suffering and I can live with the downsides of medicine, which is sometimes we can't save every single patient. And for high achieving students who put this career on a pedestal, it can be a very, very jarring experience to have to experience that the first time in medical school, where now you're questioning all your life decisions. So it's so important to get these clinical experiences early. It's so important to work with patients. And there are certain volunteer activities that I highly recommend for my students to do, such as doing your EMT certification. I'm getting becoming a paramedic, for instance, because you really get a raw experience of what it's like dealing with working with patients and dealing with that raw emotion of having somebody about to code in front of you. And now you need to, be there for that and be there for that person and be there for that person's family. And so again, that emotional maturity becomes part of the process. I talked already a lot about discipline and focus. I cannot emphasize that enough. I think most students, in high school, you learn all the amazing things about calculus and physics and history, but nobody really teaches you how to build a routine and how to build a schedule and how to be focused and how to build discipline, right? And I think that becomes the key here in preparing you and preparing your child, right, for medical school and the realities of a world where sometimes you can't retake the test. And if you fail, you fail, right? And that's it. And if you didn't prepare, you didn't prepare, and you have to face the consequences. And that is how medical school is. They give a little bit of leeway, but they're expecting the top students. And if you fail one class, they might let you retake it. But if you fail two classes, now you're on probation. And if you fail three classes, you have to leave the program. So, and that's across the board for most medical schools. So, fighting against things like procrastination, working on things like depression or perfectionism, the mental part becomes just as important, I think, especially when you're in this like high achieving field and high pressure field. Community volunteer experiences. So you have to like people, okay? Yes, you could become a pathologist and you don't necessarily need to deal with patients as much. That's true. That would be the counter argument to, you have to like people, but no, you really have to genuinely want to help people and you really have to genuinely have to like helping people and you have to like your community. And so medical schools want to see that. They want to see that you're committed to your community because when you're a doctor in a small town somewhere, everybody knows you, right? And you have to be able to build those relationships and those connections and want to help and want to go the extra mile to really do the most for the patients that you're working with. You have an obligation, a commitment, a responsibility to them. And lastly, here I would say is, and this is mostly, I think, for the parents because you want your child to be successful. I get it. You want your child to be successful and you want them to be successful quickly, right? And because it's a long road. And so I find that sometimes parents can really push, their students, their children to take more classes or to do more. And that really ends up hurting the student because if you're not ready to take a class like organic chemistry, you're not ready. And that's it. So don't take it, right? Take the classes when you have developed the discipline, when you have developed the focus, right? When you've developed a strong foundational base in the other previous classes, right? So again, sometimes it makes sense, right, to want to push your child to do do better because you know they can do better. But in such a high pressure environment, I've seen students crumble under that pressure because they already have so much pressure on themselves, right? And there's already so much pressure to do well on the pre-med classes, and they know they have to do more, and they know it's so competitive. So my best advice for parents is to understand that, this is not, your child's not trying to, get a bachelor's degree and start working in the workforce, right? This is not a computer science degree and you're going to become an engineer and work for Google. This is a situation where it's everything that they do is very delicate and it has to be very precise and intentional. And sometimes it's strategic to take a little bit longer and do it right than to try and do it all at once so that you can finish fast. And I've seen students where they try to take all these classes in one semester and then they get C's and D's, and then it becomes much harder to fix that. So those are my keys to success. Um, this is just more information about the different parts of the medical school application. So as a consultant, I will work directly in making sure that whoever is my student, we kind of go through the GPA, which is calculated as your cumulative GPA or science GPA, the MCAT score, and then we talk about different sort of activities that are going to make your application stronger. So having leadership is really important in medicine, being able to step in and lead people in a time of crisis is a skill that they want to see. Clinical experience, I've talked about that, volunteering, right, working with the community. And for certain schools, like I said, MD programs, they want to see some research. And again, it doesn't have to be lab research. It could be sociological research. Another component would be the recommendation letters. So having somebody who has graded you, has seen your work, who has gotten to know you in office hours in college, for instance, or in high school, if you're in high school and you're applying BA, MD programs, having a science teacher, right? Maybe it's your AP Bio or honors biology teacher, be able to vouch and say, yeah, Farah, she did great. She was always asking good questions. She worked well with others. She really showed command of the material, and she was very inquisitive and curious, right? Those are positive things that you want. You want credible people to say about you, right? And so recommendation letters become really, really important. And strategizing which classes to take, which professors to ask for becomes also a very important part of the process. And then lastly, awards, right? So again, this is not a requirement for medical schools, but if you are right now in high school or you're in college and you're doing well in your classes, your GPA is good, your MCAT is good, you have a ton of activities, and you have great recommendation letters. And now you're thinking, I want to go to, I don't know, a top school like Hopkins Medical School or Harvard. Then these awards become really important. How do you stand out amongst your peers, right? You all had 4 years, right? Who was the student within those 4 years was able to do all of these things and also win some interesting award or publish in a scientific journal or make dean's list, right? So these are things that can set you apart and can help with admissions when it comes to the very top schools, I would say. So typically what we offer at Potomac is we try to do some sort of planning package. So if you're in high school or in college, so right now if you're mostly, you want to go to medical school, for instance, we'll have an initial 60-minute meeting, and then we'll do 2 check-ins per year. So I highly, highly recommend this for high school students as well as college students. If you're interested in medical school and you want some sort of advising and you want some sort of direction. So you're planning early, and we're kind of working together early on so that you're not making any mistakes or you're not wasting time, right? And so we can begin to plan out your application a little bit better. In terms of the actual applications, the packages that we offer include services for up to 18 schools. And these are all the different components of the actual medical school application. So I won't get into details right now, but essentially most of it is involving the different essays that have to be written, as well as interview prep and post-admission decision-making, and basically figuring out how we're going to present you in a way that makes sense. For high school students, like I said, we really focus on college planning. So this would be 8th to 10th grades. So including help with class selection, internship application, and volunteering. If you are considering applying to BA, MD programs, we do that. So we have college admissions counselors who work with you, and if you need help with the interview prep, I would be there to consult and advise and also help so that you can talk about medicine in a way that shows that you have some sort of command over it. And so if you're interested in our services, you can uh, go on and we have a little tab where you can schedule a free consultation with me. And I'm happy to meet for 30 minutes and we can talk a little bit about your application, if you're in college already, or if you're in high school and you're thinking about it, and kind of get a sense of what you're interested in. And I'll be happy to give you some advice about what my recommendations are moving forward. So thank you all for attending this. I'm happy to answer any questions. Um, so let's see. I don't see any questions in the chat. So so if anybody has questions right now, actually hold on. I okay, here we go. We just got one. What is the most competitive MD specialty in general? Ooh. Um, I would say dermatology, actually, because hospitals usually only have two spots. So the way residencies work are that they are hospitals that offer spots and they get funding from the NIH. So that's how they are accredited to say we can graduate this person and they can do dermatology, right? And so dermatology is just so competitive because there just aren't many hospitals that have those spots. So I find that that is the most competitive and it's very attractive. It's a field where you can make upwards between 300 to $600,000 a year, having only done a few years of residency, and you can work outpatient and you don't necessarily need to take insurance, right? You can do cosmetic dermatology. And so it's a lucrative field and hours are really, really great. And so it becomes quite attractive, I think, for people who are interested in that sort of work-life balance and interested in skin in general. Um, what are the resources to prepare for the MCAT? So that's a good question. There are plenty of resources. So there are big companies like Princeton Review, so the same companies that you might have heard about for the ACT or the SAT. So those big companies do offer MCAT prep. There is, of course, private tutoring. So I have tutored students one-on-one on the MCAT. There are AAMC resources. So those are basically offered by the organization that actually administers the MCAT. They have practice tests, they have question banks. So there is no shortage of resources for the MCAT. The question really becomes, is the student improving? And that's really where I would say if there are so many resources, but the student's not improving, then there's another situation happening here, right? And that becomes, do they have a strong scientific foundation? Did their undergraduate classes properly prepare them for the MCAT? Are they just memorizing, right? So there is a finesse to how you study for things like the MCAT. And that's really what I work with my students on, is making sure they're approaching the questions in a way that's going to allow them to think about it the right way, not necessarily memorize everything. How do you plan about getting clinical experience when your parents or any relatives, sorry, I can't read what this says. When your parent, I guess the question is, how do you how do you plan about getting clinical experience when there is nobody in your family who is in the medical field? So you can just reach out to your pediatrician, right? You can reach out to your family medicine doctor, as a parent, you can do it, but usually doctors want to see the students emailing them. So if there's a private practice, right, outpatient clinic, very normal for a high school student to just email or visit the clinic and say, hey, I really want to shadow. I'm interested in medicine in medical school one day. I want to know what it's like. Is it possible for me to get some volunteer hours for a shadowing experience? And depending on the doctor or the specialty or the practice, they'll say yes. If there's a hospital nearby, like Suburban Hospital, they have volunteers. They have volunteers at Suburban Hospital in Bethesda. So that's another way to do it. And they have programs. But I think the best way to do it is to just cold call, email, and the specialties until somebody says yes. And maybe you don't get the specialty you're interested in. That's fine. Sometimes hospitals will actually have physician shadowing programs already in place. So I think the best thing is at the high school level, try to work with maybe a pediatrician or a family medicine doctor, somebody you already have a relationship with, and see if they might recommend someone else if they can't do it themselves, or if they can do it themselves, that's awesome, right? Okay, next question. What are the specialties that offer the best work-life balance? Um, so the most competitive specialties, I would say. So interventional radiology or radiology, usually, and I say interventional because it's a more of a procedural specialty and it's outpatient. So there it's different. You don't have to take call. You're not dealing with 3 a.m. You have to, it's an emergency situation. Dermatology, like I mentioned before, anesthesia is a good one as well. Those ophthalmology is another one. So that's like an eye doctor. Again, that's outpatient. So they all have something in common, right? It's outpatient, meaning you don't have to be in the hospital, right? Dealing with medical emergencies, right? Unless you are a certain type of anesthesiologist, but like a pain medicine doctor who has to do an anesthesia residency, can do it outpatient, right? So those are other types of specialties that I would say offer more of a work-life balance and also high pay, which is again why they're so competitive in my opinion. But there are other specialties, like I mentioned, that are still competitive that don't have a good work-life balance, and those tend to be more of the surgical specialties. Okay, any other questions? Does the student need to know which specialty they want to go into to be accepted into medical school? Is not knowing a negative. So, no. So, I would say something that is important is when we apply to medical school, it is important to kind of show medical schools that you have an idea of what specialty you're interested in. Okay. So, for instance, for me, I had shadowed so many different doctors. And really, the one that made the most sense when I was personally applying was oncology because I was working at National Cancer Institute. I was shadowing an oncologist. I took cancer immunology courses, and I took cancer biology courses. My recommendation letter was from a cancer immunology class that I took. So it just kind of makes sense. And when I was interviewing, they would ask me questions like, what kind of doctor do you want to be? And they're not asking you to commit. That's not a commitment. They just want to see that you were interested in something. And what did you do when you were interested? Did you pursue it fully or did you kind of dabble with it, right? And, I see students like myself who dabbled with many different types of specialties, who kind of had an idea of what they were interested in. And then when it's time to apply, it becomes hard to create a cohesive narrative. And that's the strategic part here that I was talking about earlier, which is it's much easier to talk about things if you have a specialty in mind, right? Because then your rest of your application will make sense. So that's typically my kind of approach is I like to see students have an idea. So like if you're somebody who majored in psychology, for instance, I think it makes sense, right? That you should have explored neurology or psychiatry, like maybe the mental health stuff, right? Why else would you major in something like psychology? unless you were interested in something about it, right? So that's really what they're looking for is, are you pursuing things that make sense to what you've done, right? So if you're a physics major, then it would make sense that you would be maybe interested in radiology a little bit because there is some imaging there that requires some sort of physics. But if you're, majoring in economics and you're pre-med, and then you're trying to convince people that you're interested in neurosurgery, okay? But you haven't done any shadowing in neurosurgery, it's not going to make sense, right? And all your work has been in, I don't know, cardiology, then it's going to not be as convincing, right? So that's why I say it's important to kind of have an idea of what you're interested in and prove that you're interested in it. And how do you prove that? It's through your activities and your experiences. I hope that answers that question. Um, okay. Any more questions? I can probably take one or two more. Okay. Oh, all right. Yeah. Okay, I think we're good. So thank you all for joining today. I'm really, really happy that you were able to attend this seminar. I think it's going to be recorded, and so you could go back and rewatch it. If you have any sort of questions about what I talked about, I'm happy to go through it. I highly recommend you schedule a consultation. Like I said, it's 30 minutes free. You get to come to me with all your questions and all your concerns, and my answers will be tailored for you specifically, so personalized. And like I said, thank you all for joining me on Saturday night. I know it's Saturday, and I'm sure all of you have important things to do, but thank you again, and hopefully I hear from some of you. Best of luck in your journey.